Really good COVID vaccine news, and that's the authorization of the Pfizer vaccine for children and teens between 12 and 15 years old, both by the FDA earlier this week and as just came in about an hour ago, a recommendation from the CDC to go ahead and vaccinate that age group. So I think as most people know, the FDA expanded the emergency use authorization of the Pfizer vaccine to include this age group. And as I mentioned about an hour ago, the next step was completed, which was the CDC's Advisory Committee on Immunization Practices recommending that this vaccine be given to the 12 to 15-year-old age group. So as we discussed in last week's briefing, the clinical trials for this age group showed that the Pfizer vaccine offers really exceptional protection against COVID. None of the participants who received the vaccine became infected with the virus, and there were no serious side effects either. So having this safe and effective vaccine available for this age group is just extremely good news. Now, getting vaccinated does a couple of things. Not only does it protect the adolescents and their family members from the virus, but it also helps decrease transmission in our communities and gets everyone that much closer to a normal life. Now, kids who are protected from catching and spreading COVID will be able to return to all those activities that we know are so important at this age. It'll decrease absentee in the classrooms, missing fewer days, participating in sports, all those things that we've missed out on or missed over the past year. As with adults, adolescents who get the Pfizer vaccine will get 2 doses, 21 days apart. And we encourage parents with questions to speak to your healthcare providers and discuss any issues. All of our healthcare systems are now scheduling vaccinations for this age group. Please remember, though, that in order to receive the vaccine, you can't have any vaccine 14 days prior. So if you're scheduling your kids' vaccines, make sure you're sequencing them appropriately, or talk to your healthcare provider's office to make sure you're meeting all those dates. So as the rollout of the vaccines for adolescents begins, we'll continue to share some updates about where we're going and how to get the virus. I apologize, I didn't advance the slides with that. Well, let's go ahead and move on to our total doses today. So with that, we'll turn to our overall status of vaccinations. So to date, vaccinators in Region C have administered 1,566,064 total doses of COVID vaccines. And so that includes around 900,000 first doses and around 700,000 2-dose complete series. And remember, this data is a little bit conservative because of the delay getting data into the database and some of the data from the federal vaccine programs not getting into this database. So these should really be viewed as almost a minimum. It's almost certainly larger than this, but still good news. Now, as we all know, now Missourians from 12 and older are now eligible for free COVID vaccine. Just remember that 12 to 15 is only the Pfizer vaccine, though. And you have a lot of choices about where you can find a vaccine now. Certain places will not have the Pfizer vaccine, so they may only have Moderna or the J&J vaccine. So make sure if you're taking your family member who's in that 12 to 15-year-old age group, make sure that where you're going has access to the Pfizer vaccine. Now, you can find more details and links to register for events in your area at covidvaccine.gov/events. So that is, once again, covidvaccine.mo.gov/events. So in addition to those larger events, you can find vaccine through your healthcare provider, local public health departments, pharmacies, and of course through that vaccine.gov website. Okay, moving on now to our hospital admissions data, and this, we're starting to see some encouraging signs in our admissions data. So we're reporting our daily admission number is now at 30, and remember that's delayed by 48 hours. And our rolling 7-day average is now down to 32. And so I was looking back through the data before we came down here today, and we did hit 32 as an average about a month ago or 2 months ago. But before then, it was up until late summer of last year. And so we are trending in the right direction. So very, very positive numbers. Our hospital census numbers, today we're reporting 211 hospitalizations with confirmed COVID positive patients. And the moving average now is around 216. A little bit more detail on our numbers. So as I mentioned, 211 hospitalizations with COVID-19, 65 patients in the intensive care unit, and 36 confirmed COVID patients on ventilators today. Now taking a look at our suspected COVID patients, today we're reporting 18 patients hospitalized today with suspected COVID. We have 4 suspected COVID patients in our intensive care units, and we have 5 suspected COVID patients on ventilators today. Moving on to some more good news, which is our discharges. Yesterday we discharged 42 COVID patients from our task force hospitals, and that brings our cumulative total to over 22,000. So 22,022 patients have been discharged from our task force hospitals since the beginning of the pandemic. And again, just a shout out to all of our healthcare workers for everything that they've done to take care of these 22,000 patients and get them better and back home to their family and friends. More good news, we're only reporting 1 death yesterday from our task force hospitals with COVID-19, and it brings our moving average down to 2. And so, you know, that's always good news when we're getting closer to that 0 mark. And so excited to see these numbers coming down. A little bit about our modeling data. So again, we run these models every Thursday, so we'll update them again tomorrow. It's tracking fairly closely to our best guess, maybe a little bit above. I suspect that once we start incorporating this new data, that we'll take a look at whether we need to tweak the model or not. But tracking fairly closely. It's a gradual decline right now. Hopefully with more people becoming vaccinated and the cases coming down, the model will adjust down as well, but we'll see. And again, same picture with our ICU census. You can see that little bit of an uptick there from a week ago, but hopefully those numbers will start trending down as well. Okay, moving to our report card. We remain green on our bed occupancy status, so you can see there about 5% of beds in the task force hospitals now have a COVID-19 patient in them. And our ICUs are a little bit under 10%. We want to keep it under 10%. That's our threshold for moving up into that amber area. And hopefully with that decrease in admissions and more vaccine rolling out, we will see that number continue to go down. So this is what I was talking about earlier, and you can see from the graph there is a trend down. We've got down to that 32 7-day average mark. And so hopefully that trend will continue. You know, we'll look at it over time, but it does seem to be sustaining in going down. But again, we'll keep an eye on it, and hopefully it will continue to go down. We're still at a prevalence of about 1.7 per 1,000, which is still in our red zone, but again, that has started to take a trend down as well. We know that cases are starting to drop across the metropolitan area, and so that'll influence this number as well. As well as this number, and so we're in the positive on this. So the way to look at this is the immediate 14 weeks, how did that compare to the previous? And if we're going down, then this number will come down. And it is, and so we're excited that this is in the green area as well. And then our testing positivity rate, so again, this is testing that's done by the healthcare systems, down to around 6.4%. Which, as you can see, is also trending down. I think we were around 10% maybe 2 weeks ago, and so more good news of our percent positivity coming down. And then lastly, really excited to see our reproductive factor down below 0.9, and I think the last time I spoke I said, you know, we'd like to have it sustained below that 0.9 to know that we're really interrupting transmission. And so, so again, positive news from most of our indicators coming out today. So just to wrap things up for today, we're headed in the right direction, and it is, you know, it's really exciting to see those metrics turning green, and the vaccinations, although slowed, are continuing to rise across the region. It's also really exciting that we're going to be able to offer vaccinations to more of the community with that approval of the Pfizer vaccine for those aged 12 to 15. But, and there's always a but, we still have work to do. There's still a significant percentage of the population that is unvaccinated and are therefore at risk of serious disability and possibly death from what is really a completely preventable disease. And so that's why we're working with multiple different partners to figure out how we can reach out to those in the community that are either hesitant and need information or those that have serious barriers to obtaining vaccines, such as transportation. But at the end of the day, we all want our lives back. We want them to go back to normal. And the surest way, in fact, the only way to get there is for everyone to get vaccinated. So we've paid a really just a dear, dear price and suffered way too much over the past 12 months. And so now it's time once again to really rally the community and get us to victory over the virus. So please, if you know someone who's not been vaccinated, speak to them about its importance. Talk to your physician. They've all been vaccinated. They can talk to you about that. Ask for assistance if you need a ride or some help getting registered. Remember, the vaccine is completely free. There is help out there, so please ask. Just take that small step so that we can all get back to our normal lives. And with that, we'll take some questions from the media.
The pace of the new vaccinations has slowed. How does that affect your expectations for the next few months?
Yeah, so the challenge with the slowing vaccine is, of course, when can we reach what everybody is talking about, that herd immunity concept. And it's really, it's more of a math issue than anything. The faster your rate is, the less time you need to reach herd immunity. And so the more people that we can get vaccinated faster, the quicker we can get to relaxing public health measures and being able to enjoy doing all of those things we love to do. And so we had some original projections of end of June, beginning of July. And of course, our vaccinations have slowed since then. And so those projections, of course, then push out to later in the year. Now, hopefully, with the increase in availability of people to get vaccinated, that 12 to 15-year-old age range, if we can get more out into the community, get more people engaged, get more people whatever barriers they have taken care of so they can get vaccine, the better off we'll be. But it's really it's a much different sort of approach than where we were earlier when supply exceeded demand. But bottom line is, anytime you slow down, the longer you push out the time frame, and we all want that to be shorter.
That's the only question we received today. Thanks for watching.